Child maltreatment is a serious concern in pediatric healthcare with millions of children victimized every year. Primary care providers, or PCPs, are mandated reporters of child maltreatment, but need resources to aid in the recognition of abuse and neglect. The purpose of this systematic review is to evaluate instruments that prospectively measure child maltreatment in children and adolescents and to determine feasibility of use by US PCPs. Our method consisted of two different searches. The first search was to identify child maltreatment measurement instruments being used in research articles. The second was a reference search within the articles that used an instrument to locate the original studies for each instrument's development or validation. The original studies are what we use to gather data on each instrument in order to evaluate if they could transition from the research setting to being used in the clinical setting. We use the consensus-based standards for the selection of health measurement instruments, or COSMIN, to evaluate the psychometric properties of each instrument. Then, we developed a quality metric based on 8 criteria to rate each instrument for feasibility of use by PCPs. 6 criteria were derived from the COSMIN manual, and we added 2, psychometric evaluation and construct measurement. There were 27 different child maltreatment measurement instruments identified in the 111 included articles. 16 of those instruments met inclusion criteria and were evaluated for feasibility using our quality metric. The metric is weighted with the highest weight placed on psychometrics, intermediate weight placed on construct measurement, type and ease of administration, instrument length, and completion time, and lowest weight placed on ease of scoring calculation, availability, and cost. None of the instruments in our review reported data on all of the psychometric properties in the COSMIN manual, and we were unable to find one instrument superior to others, which is consistent with other systematic reviews on child maltreatment measurement instruments. Robust psychometric properties are optimal for research instruments, but a complete psychometric profile may not be necessary for use by a PCP, which supported our decision to evaluate additional feasibility criteria in order to determine appropriate selection of an instrument. The characteristics of PCP practices extend along a continuum from rural sole provider practices to large urban multidisciplinary practices. It is unrealistic to envision that one instrument would meet the diverse needs of these different practice situations. Therefore, the 6 instruments that receive the highest feasibility ratings are recommended for use by PCPs dependent on the needs of their individual practice. In conclusion, this systematic review highlights the combination of psychometric evaluation with other pertinent feasibility criteria to recommend 6 child maltreatment measurement instruments for use by PCPs. Thank you.